5 on your health tonight, ending vaccine mandates for children. There's a chance that it could happen after President-elect Trump returns to the White House in January. Sorry about that. Joining us now is Dr. Todd Ellerin, Chief of Infectious Diseases at South Shore Health. Great to see you.
Good to see
you. So
you.
let's start with Robert F. Kennedy Jr. Yesterday, Donald Trump nominated him as Secretary of Health and Human Services. What's your reaction to that?
Well, I think this is obviously a very important position. You're really the lead health person in the United States. You're responsible for 13 agencies, over 85,000 employees. This includes the FDA, the CDC, the NIH, Medicare, Medicaid. So think of things. This position is responsible for vaccines, food safety, cancer research, what obesity medications, the Lipitor we take, so as well as millions who are insured with Medicare and Medicaid. It's an important position.
So let's say this. Kennedy has said he is not anti-vaccine. He's pro-vaccine choice. He does not support mandates. What does that mean to you? And what should that mean to us?
Right. Let's talk about vaccines for a second. In a prestigious journal called The Lancet this past May, they did a modeling study and showed from the mid-1970s until now that 150 million, you heard that right, million lives have been saved because of vaccines. They say that every minute 6 lives have been saved. So I think that vaccines obviously are one of the most important medical developments, of anything. So I think that, we can't underestimate the importance of that.
So when families ask you for proof that vaccines work, what do you tell them?
Right. So it's a great question. So I think one of the problems is what I call historical amnesia. What do I mean by that? In the early 1900s, 30% of mortalities were in children under 5. Why is that?
That's a big number.
Sanitation,
right.
Poor sanitation, access to care, poor nutrition, but also the fact that there weren't vaccines. Since 1970s, that study I just showed, most of those children who had died before, most of those deaths were in children. So the point is, since the mid-1970s, there's been a 40% reduction in infant mortality. So I think what's very important is that we didn't live necessarily through the 1940s and the 1950s when polio and measles were running rampant. They didn't disappear just because of luck. They disappeared because of the blood, sweat, and tears of scientists and investigators and people that really came up with these safe and effective vaccines. I just think it's important that we follow evidence-based medicine.
Okay, Dr. Todd Ellerin, thank you. We appreciate it.